everyone, and welcome again to ALTY's Bone Healthcare series with me, Sarimah Ibrahim. As usual, we're going to be talking about all things related to adding life to your years, and that's what ALTY stands for. Here at ALTY, of course, we want to focus on the patient, get the right treatment at the right time, and improve your life, my life actually, all of our lives together. So what's at ALTY? Well, we have our spine and joint centers, and that's where you can get specialty care for your spine, for your bones, for your joints, and your entire musculoskeletal system. Check out my words, don't play. And I'm telling you, today is a very interesting show. You don't want to leave the show, you want to stay with me because we've got very important guests with me today, one of which has come all the way from the US of A. But before that, let me talk to you a little bit more about ALTY and what's provided here. Besides having Malaysia's only weight-bearing MRI, there's also the EOS imaging machine, which is fabulous. You can step into it. It's top of the notch high-tech and can scan your whole body. What else is at ALTY? Well, you've got the best of the best. You've got 8 surgeons here with a combined expertise of, I can't even tell you how many years if you were to put it together. I mean, this is the place that you want to come to for orthopedics and many other health-related issues, because there is also the very well-known HSC screening center here at ALTY. Now, that's just a little bit about ALTY, but today's show in particular, I'm going to be talking about what ALTY is, which is a single specialty care or hospital or health center. What is a single specialty center? Let's talk a little bit about that. But first and foremost, as Malaysia positions itself to become a global healthcare leader, the country has gained a reputation, well done, for becoming one of the best healthcare hubs in the region. Now, in recent years, the industry has also showcased growing expertise in niche medical specialties such as orthopedic treatments. Single specialty hospitals also help to address gaps that are in Asia's current healthcare delivery. Through the increased focus and specialization of services, single specialty hospitals not only deliver healthcare services with greater efficiency, of course, but also promote innovation. How? Well, we'll talk about that a little bit later with our guests. Now, delayed electives and a sedentary lifestyle, especially here in Malaysia, you know, we've got our lepak mentality. That's how we are, that's how we flow, that's our vibe. Well, this has all contributed to the rise of orthopedic associated conditions in Malaysia and the Asia-Pacific region. In fact, the whole world. Chronic pain is one of the most critical problems that is seen, and I myself suffer from that, and I know a lot of you do too. In fact, 20% of global chronic pain cases arise from orthopedic conditions such as osteoarthritis. Ouch! Now, in Malaysia, 1 in 3 people over the age of 55 suffer from this kind of pain. I'm not there yet, but it could be coming soon. Okay, this is also followed by musculoskeletal discomfort, typically related to our shoulders, our neck, and our lower back. You know that feeling? And we always have it, and we always ignore it. And I tell you something, don't ignore it too long. Come to a place like ALTY, a single specialty care will be given to you to make sure you get the right treatment just in time before things progress into something more serious. Now, let me get to our wonderful guests today, starting with Dr. William Maloney, or Professor William Maloney, to share about the contribution and different approaches by single specialty and advances in orthopedic treatment that are available in the US and globally. Now, Dr. William Maloney is, check this out, you want to hear this, the Boswell Chair of Orthopaedics and Professor of Orthopedic Surgery at the Stanford University School of Medicine, and also the Chief of Orthopedic Surgery at Stanford Healthcare. Now, prior to his appointment at Stanford in 2004, Dr. Maloney was Chief at Orthopedic Surgery at Barnes Hospital in St. Louis and Charles Knight Professor of Orthopedic Surgery at Washington University in St. Louis. Dr. Maloney has published more than 200 peer-reviewed publications and has research supported from the National Institutes of Health and the Patient-Centered Outcomes Research Institute. Just a little bit about Professor Maloney there, and we have more. He has also participated in product development for orthopedic device companies for more than 25 years and holds 3 patents. He serves as a consultant for device industry as well as venture capital companies and private equity firms involved in healthcare. Now, that's just about Professor Maloney, and he's going to be joining us today. We are also joined by Dr. Mark Chong from ALTY, and he's going to be sharing about ALTY as a single specialty hospital and the advances in orthopedic treatment in Malaysia. So a little bit about Dr. Mark. He is a consultant trauma and orthopedic surgeon at ALTY Orthopaedic Hospital, and his expertise includes ACL surgery, arthroplasty surgery and trauma, robotic arthroplasty, and total hip replacements, among others. We're going to be doing another episode, of course, just with Dr. Mark Chong. He's also a member of the Royal College of Surgeons, UK, and a member of both the Singapore Orthopaedic Association and British Orthopaedic Association. Dr. Mark himself has published and co-authored numerous abstracts and manuscripts in highly cited peer-reviewed journals such as the Health Service Journal UK, the Bone and Joint Journal UK, and in the Annal of the Royal College of Surgeons of England, UK. Now, I need to sip some water because that's just the introduction of our two guests. So let me get straight into it and let's give them a big warm greeting. So welcome, hello.
Hi.
How's the crack, as they say in Ireland? Aha.
Good, great crack.
Pun definitely intended there. So Dr. Maloney's got Irish heritage in there, so we've just been having a great conversation there. We could be related.
Looks like we're all related, actually.
We're all related here. So welcome back to Malaysia again.
Thank you.
Dr. Maloney. He's been here several times, so I wanted to test him on his bahasa. Do you know how to say bone in Malay?
I do not.
Can you say tulang?
Tulang.
Tulang, yeah.
There
you know
You're
he's from Stanford and you've just heard everything, so ignore the tulang tu dia jadi tula, tak apa, tak kisah. So we're here to talk today about single specialty hospitals such as ALTY and how they are generally in the world, and because you're from the US, obviously we want to know what it's like in the US compared to Malaysia. So Dr. Mark, you're going to be talking a little bit about Malaysia because we're newer to this concept, but Dr. Maloney, of course, you're way advanced in terms of this. So can you talk to us a little bit about the rise of single specialty hospitals, and this, is it a trend? Is it something that's going to take over the world, or what is it?
So it's definitely a trend. When you think about single specialty hospitals, as the name applies, it focuses on one medical specialty. The three most common ones are orthopedic surgery, which focuses on musculoskeletal care, cardiology or heart disease, and then cancer. So those are the three most common specialty hospitals, at least in the United States.
Right, and it's very common, right, in the United States?
It's growing very rapidly.
And it's very patient-driven, from what I've read and from what I've researched, because the patients are the ones who like it. Let's talk a little bit about the benefits of a single specialty hospital compared to a larger hospital, your normal hospital.
So we really divide those into three areas. The first is the patient experience. So in general, single specialty hospitals have higher patient satisfaction because everyone sort of knows what's going on with you and can address those concerns. The second is outcomes. The outcomes tend to be better than a general hospital because, again, the whole team, it's not only the doctors, are focusing on the problem. And the third is cost. We can do the same procedures at lower cost, so better value.
Right, so a little bit of history here. I'd like to know how someone like yourself got to know the surgeons here at ALTY, such as Professor Ruslan and Dr. Suresh, Dr. Mark Chong. Can you give us a little bit of insight on how that started, the history there?
So we have a lot of fellows who trained in this region of the world and come to spend some time with us in the States.
Right.
So I don't want to give away my age, but probably my gray hair does that. Turning 65 next week. So
really?
Yeah. So
I thought you were 55.
Yeah,
Come on.
Thank you very much.
It's the
Thank
posture.
you very much. So Dr. Ruslan was a fellow with us in St. Louis 20 years ago, and Dr. Suresh was a fellow with us in Stanford 10 years ago.
Right.
So both were fellows with me in the past.
Okay, and you yourself here, coming into ALTY, can you give us a little bit about your opinion on ALTY as a single specialty hospital? You know, how we are, the performance, what confidence you have in ALTY?
Yeah, so I think there's several things that go into a high quality operation. First and foremost is the doctors. So they've put together, I think, the most experienced team in Malaysia as it relates to joint replacement surgery, adult reconstructive surgery, and spine surgery. So I think in terms of one-stop shopping, they have the physicians, they have the staff, and then they have the technology, the operating theaters, the imaging, MRI scan, CAT scan. So it's a very impressive facility.
Lovely. And Dr. Mark Chong, you know, you yourself here working with ALTY. Can you tell us a little bit about your role at ALTY and what you think of single specialty hospitals globally compared to Malaysia?
Yeah, so I've had significant experience working in the single specialty hospital, as my training was majority of my training was in UK.
Right.
And as in the Western world, so to speak, you tend to find that once America started the trend, the
That
rest
was
will
it.
follow suit. So the UK was very close to America in that sense. And I worked in a single specialty hospital with Dr. Suresh at that time when we were little boys.
Lovely.
So, you know, I've had
5
all
years
the,
old.
yeah. So, I mean, we have the experience of how it works. We see the changes it has on the patient.
Right.
And Dr. Maloney was mentioning about the outcome. Far superior outcome. Patient experience was much, much better. And on top of that, it was delivered at lower cost.
Yeah,
So,
no, that is
you know, that got
amazing.
me excited. I
Yeah.
said, why are we spending so much on a conventional hospital system when we can deliver the same quality of care
Yeah.
for at a much lower cost? So,
Yes.
you know, that's no-brainer.
That is a very attractive fact. I mean, for a lot of Malaysians, people would message me even knowing that I'm collaborating with ALTY now and say, you know, why is it cheaper? They don't quite understand. And I would say, well, obviously, you know, when you compartmentalize and you make something compact, you know, you don't have that many specialties in one, the focus can be there. But what I'd like to know from either of you is, because when you treat a patient, it's a holistic treatment, like from head to toe. Some people have messaged me and said, well, what if I'm in the middle of doing surgery on my spine, Sarimah, and then I have, God forbid, like a heart attack or something, and no one's there to help me because all they do is orthopedics at ALTY.
I'll let you explain that.
Well, so it's a common misconception that an orthopedic hospital only has orthopedic surgeons, or a cancer hospital
Right.
only has cancer doctors. So at a specialty hospital, we need to have the ancillary specialties to take care of the medical problems that may develop in our before surgery or after surgery. So there's cardiologists on staff, there's general practitioners on staff, there's anesthesiologists, there's other physicians that can take care of the medical problems that may occur in the early post-operative period.
So there's no worries there for everyone watching. You know, if something does go wrong prior to or post-operative, the specialists are there and the technology is there and the support, the resources are there, because some people are quite worried about that. So a little bit back to you, Dr. Maloney. I know that you've got 3 children.
I do.
And they're in the States, obviously.
They
and
are.
you know, a little bit of information on Professor Maloney, I will call him, is he's actually treated quite a lot of celebrity bones, joints, and muscles. Because you yourself, I mean, from what I understand, you were the team physician for the Golden State Warriors, and I mean, you've had people like Tom Brady and Giselle at your house. I mean, how is that?
Well,
I mean,
don't
do
know
you
about
feel
Tom.
like you're a celebrity? Are their feet any different to our feet?
I would say, without naming names, the professional basketball players have the worst feet in the world.
Because they bounce all
They
the time.
pound on them pretty good, yeah. So we had a good run. I was with the Golden State Warriors for 8 years.
Yeah.
And we had 5 championship runs and 3 rings. So it was a fun time.
Wow. So, I mean, no, but honestly, besides their feet being awful, I mean, do high-profile people and celebrities have a different backbone? I mean, I know they've got thicker skin than all of us, but are their bone structures different from their jobs, or is there anything, I mean, that you found mysterious?
When you get to that level,
Yes.
they have very few physical flaws, right? So if you go through primary school and secondary school, then university, then minor league and major league athletics, they have very few physical flaws. You can't make it and survive at that level if you
without, obviously. So they're in tip-top condition and health, and that's something that we're promoting here on our show. You know, taking care of yourself, getting the right treatment at the right time. So we're going to take a break here, and when we come back, we're going to talk a little bit about the advances in orthopedics with Professor Maloney and Dr. Mark Chong, and what's available here at ALTY. So stick with us.